All right. Welcome everyone to Safe Water Nursing Foundation's Masterclass, Cultivating Excellence in Patient Care. This is session 2, and I am your instructor, Loida E. Figueroa. I am the project director for Safe Water for Sierra Leone here in Sierra Leone, as well as in the United States of America. So it is December 20th, 2023, and we are going to get started. Here we have session 2. So this is session 2, professional behavior and character traits. So we're going to talk about discipline, personal hygiene and honesty, the importance of integrity, humility, and politeness in nursing. And I want you to make sure that you have your notes, your pen, and paper so that you can write down any new words, any new vocabulary that you haven't heard before, so that you can take time to study on your own. So, thank you so much for being here. And I wanted to start off with an icebreaker activity. So, I want you to pause this video maybe for about 1 to 2 minutes. And I want you to think about or talk about one challenge that you overcame last week and how. So, as you can see the photo here, this is a picture of some arrows pointing in different directions and a brick wall, right? So, the brick wall is representative of the obstacles that we face in our life. Every day we are faced with obstacles, and it's up to us how we overcome these obstacles. And as a future nurse, you have to know exactly how to overcome your obstacles and be able to figure out what can I do? How can I come up with a solution for this obstacle that's in my way? Because our goal is to go over that wall, right? Go around the wall, break through the wall. There's so many different ways that we can overcome our obstacles. So I want to know, and I want you to share with your class, with your classmates, with your friends, your family, whoever you are watching this training session with, and just take a few minutes to talk about the challenges that you overcame last week and how. All right. So I hope you took some time to talk about how you've overcome these challenges and what challenges you went through within the last week. We're going to move on to a recap. So, last week's recap, what we talked about in session 1, we talked about the introduction to American nursing model, the importance of nursing standards. So, again, the nursing model. The nursing model stresses a focus on both the physical and emotional needs of a patient, not only treating the symptoms, but also seeking to identify any outside influences on health and provide care and recommendations to create a healthier lifestyle for the patient. So, one of the examples that we talked about last week is when a patient comes in, let's just say the patient has a headache, right? Or I think the example that we used last week was the patient has a cough. And the patient was saying, I only get this cough whenever I go home. But when I leave home, I don't have this cough. So, what the American nursing model is explaining here in this paragraph is not only treating the symptoms, but also seeking to identify any outside influences. So, what are some of the outside influences that we discussed that could be causing this cough in this patient? Well, perhaps the home, maybe they have too much smoke in the home. Maybe they're cooking with fire and that smoke in the house, is affecting the patient and causing them to cough. Maybe there's something in the air, maybe there's a candle or some sort of smell that is affecting the patient's lungs. So it's important that we find out, well, what's going on at home? How many people do you live with? Who do you live with? Do you have any pets? So the American nursing model is about not just saying, oh, you have a headache, you have a cough, here, take this medicine, have a nice day. But it's about finding out what are the outside things that are affecting the inside of the patient. And secondly, last week we talked about the importance of nursing standards. So, the international nursing standards are guidelines and principles established to ensure a consistent level of quality and safety in nursing practices worldwide. These standards provide a framework for nurses to deliver effective, ethical, and culturally sensitive care. Several organizations contribute to the development of international nursing standards. So, again, last week we talked about how the entire world, everyone in the world, anyone that is in the nursing field, there are different organizations that have conversations that talk about what standards should all of the nurses in the whole world, in every country, follow? Because we want to be able to provide excellent service. We want to be able to provide an equal style of care to the patients all over the world. And so that's why the nursing standards are very important. And one of those standards we can discuss are hand washing, hygiene. And so those are some of the things we'll be talking about today in session 2. So, defining discipline in nursing. Discipline in nursing is a foundational element that plays a crucial role in upholding high standards of care, ensuring patient safety, and fostering an environment of overall professionalism. In the context of nursing, discipline refers to the consistent adherence to established guidelines, ethical principles, and professional conduct. Let's delve into why discipline is a cornerstone of nursing practice. But before we do, I want to direct you to this picture. What do you see in this photo? Well, we see someone dressed in a uniform, and he looks like a soldier, right? And we see soldiers all over the world. In every country, there are soldiers. And this soldier is climbing down a mountain, and he probably had to climb up this mountain. But what did he have to do to have the ability, the strength, the agility to be able to climb up and down this kind of mountain? Because this looks very, very difficult. Well, there have been disciplines that this soldier had to go through. Soldiers have to go through rigorous amounts of training, exercise, mental trainings, physical trainings, because they have to be ready for anything at all times. Anytime there's an issue or a war, they have to be ready. And so we're talking about the nursing disciplines, the different things that nurses need to do. And I wanted to highlight consistent adherence to established guidelines, consistently following the guidelines that have been set in place. Not one day doing things one way and the next day doing things a different way, and so on and so forth. But being consistent. Every single day you come to work as a nurse, you are following and you are adhering to these guidelines that have been established. Why do we do this? Well, because this is going to foster an environment of professionalism. We cannot be professional one day at work and then the next day we come to work and we lose all of our professionalism. We lose all of our discipline. No, we need to follow and we need to continue to provide excellent service. Excellent discipline leads to a high standard of care. So again, let's dive into why discipline is the cornerstone of nursing practice. Okay, well, personal hygiene in nursing. That's one of the cornerstones of the discipline, having the discipline of having a daily practice. So I want you to ask yourself, what is my daily practice? What do I do on a consistent basis every single day to maintain my personal hygiene? So let's talk about that. Having a daily routine for personal hygiene. How about bathing or showering, brushing our teeth, cleansing our mouth, flossing, scraping our tongues, washing our hair, getting our hair done, having being groomed and clean clothing, a uniform that is well maintained, pressed, laundered, right? These things prevent the spread of infections. We don't want to infect ourselves or the people that we are around, right? And then, of course, hand hygiene. Hand hygiene is critical in healthcare. You must, it's not optional. You must follow proper hand washing techniques, especially before and after you come in contact with your patient. Before you put on your gloves, after you take off your gloves, washing your hands is very, very important. And because as a nurse, you are always keeping your hands clean, you also need to make sure you have a good practice of moisturizing your hands, because after a while of washing your hands all the time, your hands can get dry. So I always recommend my nurses to, always have something to moisturize your hands, to keep your hands nice and moisturized. You don't want them to get dried out, right? Great. So we have a video here that I want to share. Okay. We're going to watch this video on hand hygiene. So here we go.
Hey everyone, it's Sierra with registerednursern.com, and in this video I want to demonstrate how to perform hand hygiene by using soap and water. There are two ways a nurse can perform hand hygiene. One way is through using soap and water, and another way is through using an alcohol-based hand rub. So when do you want to perform hand hygiene? You would always want to perform hand hygiene before and after patient care, after coming into contact with like a body fluid or an open wound, or touching something close to the patient like a bedside table, the hand railing on the bed, or after removing your gloves, before eating, and after using the bathroom. Now, when would you use soap and water versus the alcohol-based hand rubs? Well, according to CDC.gov's guidelines, you would use soap and water when your hands are visibly dirty, after known or suspected exposure to Clostridium difficile, which is C. diff, if your facility is experiencing an outbreak or higher endemic rates, after known or suspected exposure to patients with infectious diarrhea during norovirus outbreaks, if exposure to Bacillus anthracis is suspected or proven, which is anthrax, before eating and after using a restroom. So now I want to demonstrate how to perform hand hygiene using soap and water. So first, you need your supplies. Of course, you need soap, you need some paper towels, and you need running water. Now, faucets vary depending on where you work. Some are automated. You just have to swipe your hand underneath, the water will come on, or you use a pedal. Or it has little faucet handles that you have to use to turn on and off. Now, generally, it's best not to wear jewelry during patient care because that jewelry can harbor germs. In some areas in the hospital, like surgery, for instance, actually prohibits a person from wearing jewelry altogether. But usually on some units, you can wear like a simple wedding band. So if you do wear a wedding band and you're wearing it during patient care, you need to keep that wedding band on whenever you're performing hand hygiene because you want to clean it, because underneath that ring it can harbor germs as well on our water. And we want our water to be warm, not too hot, because if it's too hot, that can dry out the skin and that can cause you to get cracks in your skin, be really uncomfortable for you. So make sure it's warm. And you want to be careful not to let your scrubs or anything like that touch the inside of the sink because it's very dirty and you'll become contaminated. So once your water is warm, you want to wet your wrists and your hands, and be sure you have your hands lower than your elbows because we don't want the germs that are already on our dirty hands to travel up our arms. After you've wet your hands, you want to put the soap on your hands, and you're going to put about 1 teaspoon of soap, which equals about 5 milliliters. And a lot of soap dispensers are automated and they give you the amount of soap you need. So we're going to take that soap and we're going to lather our hands and our wrists with the soap. Now we want to scrub. And what we're going to do is we're going to scrub the soap on our hands using circular motions because this is going to help remove those germs and the things that are sticking to our hands. And we want to cover all the areas of our hands, especially those small crevices, because that's where bacteria likes to hide. We're going to do this for 20 seconds. So first we're going to go and scrub our palms of our hands. Notice I'm doing a circular motion. Then we're going to get the back of our hands and do both using those circular motions. Then we're going to do our thumbs, and we're going to do each finger individually, making sure we are getting around the fingernail area as well. And then you want to get those knuckles. So really rub the knuckles up against your opposite hand. It's also going to get the outside of that fingernail as well. Then we want to get in between our fingers because, again, germs love to hide in little crevices that are hard to get to. So we're going to make sure we get that. Then we're going to pay attention to our fingernails, and we're going to take our hand, we're going to go to the opposite hand, and we're going to just get underneath the fingernail right in there, just scrape around, remove any germs that could be underneath those fingernails. Then what we're going to do is we're going to get our wrists and go about 1 inch above the wrists as well. Now we are ready to rinse the soap off. So we're just going to put our hands underneath the water and let the water go downward. We don't want it to go upward. Rinsing all of the soap off from the wrist down to the fingertips. Once you get them rinsed, you want to take your paper towel and you're just going to pat your hands dry. You don't want to scrub your hands with this paper towel because that can damage that top layer of skin. And we're going to discard this wet paper towel. Then we're going to grab a dry paper towel and turn off our faucet, and being careful not to touch the faucet with our clean hands. And then we're going to discard this as well. Now we wouldn't have used our wet paper towel to turn off the faucet because the germs that are on the outside of the faucet could have transferred through that wet paper towel and got onto our hands and undone the job of what we just done with cleaning our hands. Okay, so that wraps up this video on how to perform hand hygiene using soap and water. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
Okay, so I want you to take a few minutes to pause this video and have some discussion about what things you noticed in this hand hygiene tutorial that you didn't know before, something that was completely new to you. So go ahead and pause this video and talk a little bit about, or take some notes about, what are some of the new things that you learned about hand washing, and maybe mention some things that you already knew. So go ahead and take some time and discuss. Okay. Next, we will discuss the importance of integrity, humility, and politeness in nursing. So, integrity. Read with me. The quality of being honest and having strong moral principles that you refuse to change. Humility. The feeling or attitude that you have no special importance that makes you better than others. And finally, politeness. Showing good manners toward others, as in behavior, speech, etc. Courteous and civil. So let's start with integrity. Let's break it down. The quality of being honest and having strong moral principles that you refuse to change. I love that word, refuse. You know, someone that has integrity is someone that will stand firm on their decisions, that there's nothing or no one that will come in between their moral principles. So, as a nurse, it is important that you have integrity. The qualities of integrity allow for you to be a trustworthy nurse. Your team, your doctors, they can trust you because they know that if nobody's watching you, you will have the moral principles to do the right thing, to be honest. And this is very important because as a nurse, as a new nurse, you're going to make mistakes. And sometimes if you make a mistake that causes harm or maybe messes something up, some people might feel like they have to hide that or that they shouldn't tell anyone about it. But someone that has integrity, a nurse with integrity, refuses to waver, refuses to change the fact that they are willing and they're going to tell the truth and be honest. That is their moral principle, that no matter what, even if I made a mistake with someone watching me or not watching me, either way, I'm going to speak up and I'm going to let someone know. You know, I gave an example when I used to work at the bank. I was a teller at a bank, a cashier. And every night before you leave, you're supposed to lock your drawer, the drawer that has all of your cash in it. Because if you don't lock it, then you are leaving it exposed and anybody could steal the money from there. No one knows what could happen. So you're putting the bank at risk. I didn't know. So I had no idea that I had left my drawer unlocked until I came into work the next day. When I came into work the next day and I went to open my drawer, it was already unlocked. And to be honest, nobody could have known. Nobody saw it happen. It's not something that people would know that happened, except for the cameras. But the people watching the cameras are in a completely different office in another place, in another state, probably. And so my integrity was at stake. My integrity was being tested. My moral principle of having to tell someone, telling my manager, I left my drawer unlocked last night. I refused to allow myself to keep it a secret. And so I didn't care what the consequences were. And I held my integrity. And I went and I told my manager, last night I forgot to lock my drawer. Could you please audit my cash box? And so the manager, had to go and audit my cash drawer, make sure that it was balanced, and then make a report and note that I had left my drawer unlocked. And so these are very important qualities because at Safe Water Medical Center, our nurses are integral. Our nurses have integrity, have morals, and are willing and unafraid and unashamed to tell the truth about anything that has happened or any mistake that they may have made or something that they saw someone else doing that was not right. They are going to speak up and they're going to communicate this with their supervisor. Number 2, humility. To be humble. Humility is the feeling or attitude that you have no special importance that makes you better than someone else. Imagine if I didn't have any humility and every time I was teaching my students, I would walk in like, I'm the teacher. These are my students. They must listen to me. That's not having humility, is it? Thinking that I have some kind of special importance that makes me better than anyone else. No. We must, as nurses, anyone in the medical field definitely must have humility. Because whenever you're entering a patient's room, that patient is going through something. They're not feeling well, or they're healing from something, some kind of disease. So when we show up to their room, we show up with our defenses down. We show up with an open heart, with love, with humility. Hello, Mr. So-and-so. Hello, Mrs. So-and-so. Right? We are humble. I'm not more important than the patient just because I'm the nurse, but I am here to serve them. I am at their service. Number 3, politeness. To be polite means to be kind, showing good manners towards others. Good manners. Thank you. Please. Yes, sir. Yes, ma'am. Good afternoon. God bless you. Those are good manners. Excuse me. These are all examples of good manners. In our behavior, our attitude, do we have a polite attitude, a smiling face, a warm welcome, a warm sound of our voice? Or are we speaking very sternly and hello, hello, welcome, yes, come, come, come? So our speech, how does our voice sound? Is our voice soothing? Are we bringing peace and comfort and relaxation to the patient that is not feeling comfortable, that is going through pain, or that maybe feels angry? So soon we're going to watch a video that's going to give us an example of what's the right way to treat a patient and the wrong way to treat a patient. Politeness, to be courteous. What is the meaning of courteous? Well, courtesy. Courtesy is when you do something for someone out of your own willingness and desire to do it. Courtesy is something where there is no law that says that you must do this, right? Some of the examples that I mentioned were when someone comes to visit your home, being courteous to them, welcoming them. Please have a seat. Can I get you something to drink? Are you thirsty? Are you comfortable? Is there anything I can get for you? That is being courteous. But there aren't any laws, that say that you have to do that. But believe me, your courtesy, your good manners, your speech, your behavior, all of those things are going to attract people to you. All of those things are going to make your patients remember you and maybe even request you when they come in. When they come into Safe Water Medical Center, they might say, I want to speak to Mamunatu. I want to speak to Zainab. I want Zainab to be my nurse. I want Saleh to be my nurse. Right? I want Mariatu to be my nurse. I want Wada to be my nurse. That is beautiful. When you can leave a good impression, leaving a great impression. And lastly, the word civil. Civil, to be civilized. As a nurse, whenever we have the opportunity to work inside the Safe Water Medical Center, there's going to be times where you're going to be huddled in a room with the other nurses or with your coworkers, with the doctors. You know, the way that we carry ourselves must be in a civil manner, a professional manner, not like children or chickens or dogs or, people playing a sport, or anything like that. That's not civilized. That is more of like, kids, they like to run around, they like to scream and shout and all of that. But when we walk into the Safe Water Medical Center, there should be a level of high excellence and quality. And so being civil, as we're speaking with one another, speaking to one another with kindness, with a beautiful speech and peace and calmness, soothing tone. Because in this medical center, there are people that need peace, that need love, that need tranquility, calmness, because they've been suffering from stress and pain and any other problems out in the world, like we talked about earlier in the lesson, obstacles. Some of our patients will be coming in dealing with obstacles and challenges that they don't know how to overcome. So, as a nurse, it is important that we have integrity, that we have humility, and that we are polite and kind. All right. So we've got 2 videos to show. The first one is on how to greet a patient. And the second one is how to deal with an angry patient, the right way and the wrong way. So let's take a look.
How to greet a patient. Remember to respect the patient's privacy. Knock on the door before entering.
Hello, Miss Angelica?
Yes,
Hi, Brittany. I'm going to be your medical assistant today.
Make eye contact when greeting the patient.
Can I have you verify your name, please?
Angelica Marquez,
Okay, and your date of birth?
August the 14th, 1985.
Patient identification is extremely important. Please ask the patient to state their name as well as their date of birth.
Verify your name, please.
Yes, ANGELICA MARQUEZ.
And your date of birth?
August the 14th, 1985.
Okay, I'm going to get started on your vital signs. I'm going to go ahead and let the doctor know that you're here, and I'll be right back.
All right, thank you.
Alert the physician that the patient is ready by using a flag or light system.
EduMed, your final step to success.
Okay. So a few things in that video that I noticed is when you come in to greet the patient, you tell them who you are, your name. Hi, I'm your nurse, Nurse Loida. I'm going to be helping you today. Could you please tell me your name? How do you spell your name? What is your date of birth? And then you tell them the doctor will be right with you, okay? And then you do something to alert the doctor so that the doctor knows this patient is ready, okay? Center, we may have a little sign that you can put next to the door just to show the doctor that the patient is ready, okay? And the next video is angry patient. So let's check it out.
Julie, I'm your nurse. I saw your call light was on.
I pushed that call light over 30 minutes ago. Where were you? I'm in a lot of pain right now. I need something.
Okay, I was probably saving a life somewhere. You know, you're not my only patient, so what can I do for you now?
I'm in a lot of pain. I said I need something right now.
Okay, I looked at your chart and you can have something in 2 hours for pain medication. 2 hours, and then I'll get you some and we'll be good.
I don't think you understand. My husband just left. I'm here all alone. I've never had surgery. I'm in pain right now.
Ma'am, I already told you I cannot get you anything for your pain medication right now. So when I can, I'll be back, and until then, call me if you have a real problem.
You're such a horrible nurse.
Hi, I'm Julie. I'm gonna be your nurse now. I saw that your call light was on.
That was 30 minutes ago. I'm in a lot of pain. Where were you?
You know, I got stuck with a critical patient and I got held up in that room for a little bit.
This is horrible. I've never been treated like this anywhere. I'm in a lot of pain. I've never had surgery before. I need something for my pain.
To you earlier, what level is your pain right now? From 0 to 10, 0 being no pain and 10 being the worst pain you ever had. What number would you give it?
It's like an 11.
Okay, I'm sorry your pain's that high. Let me call the doctor and we'll see if he can write you for something new, or if we can get your pain medication maybe a little bit earlier if he's comfortable with that. But I'll make sure he knows that your pain is very high right now at 11.
Yes, that does help me a little, knowing that the doctor's could possibly give me something different. My husband just left and I'm here all by myself. On top of being in a lot of pain, I'm scared, I'm uncomfortable, and I really need to feel better.
This is your first time in hospital?
Yes.
Yeah, that does make sense. That's a lot of new things for you, huh? Okay. Is there anyone you'd like to call or me to call? Is there maybe a phone I can get for you?
I'm okay right now. I think I'm in too much pain to talk on the phone.
Okay, let me go talk to the doctor about that and see if there's anything he can do. I'll make sure he knows about your pain. And then after that, because you don't have any family here, I'm gonna make sure that I come in at least every hour, if not more, to check on you and see if there's anything I can get for you and make sure you have everything you need here.
Okay. Thank you. That does help. Thank you.
Okay. Let me put your head down a little bit, okay? See if that makes you more comfortable. You let me know.
Okay. That's good right there.
Okay?
Yeah,
all right.
let
me go speak with the doctor. I'll come back and I'll let you know what he says, and then we'll go from there.
Okay.
Okay?
All right. Thank you.
You're welcome.
So don't worry. Be happy. Don't worry.
So what did you notice? Take some time to pause this video and write down a few things that you noticed, the differences that you noticed between treating an angry patient the incorrect way and the right way. What were the differences? So go ahead and take some time. All right, everyone. So we have reached the end of our session 2. And next week, we will be in session 3 discussing the introduction to anatomy. So we're going to talk about the basic terminology and concepts in anatomy and an overview of major body systems. So thank you everyone for sticking around and watching this amazing video. I hope you subscribe to our YouTube channel for Safe Water for Sierra Leone, that you hit the like button, and that you join me again for next week's session on the introduction to anatomy. So thank you for joining this amazing masterclass. I will talk to you soon. It's your girl Loida E Figueroa from Safe Water for Sierra Leone. Have a great day.